Well, thanks for staying with us. The second half of Colorado and Company. I'm Denise Plant. You know, there's a program called the Community Paramedics, pioneered by Eagle County Paramedics in the VAIL Valley. It expands the role of EMS workers to provide health care services when access to physicians, clinics, and/or hospitals is difficult. We've invited Kevin Creek. He's the Community Paramedic Supervisor for Eagle County. He joins us to share more about what he does. Nice to see you.
Hi, Denise.
A community paramedic. Tell me about it. What do you do?
It is a, typically EMS focuses on the problem after it has already happened. So 911 is called and we respond and pick the patient up and take them to the hospital. Community paramedic focuses more on the prevention of the problem so that we keep people out of the hospital, out of the emergency rooms, and off of the ambulances.
So you're looking for community paramedics. Obviously, how does someone qualify?
Paramedics go through a typical paramedic program, get hired by an agency, and then to become a community paramedic, there's an additional class that they go through, which focuses more on the long-term health of the patient, nutrition, socioeconomic problems, things like that.
Once you get into a home, talk about the safety assessment that you do.
Well, every patient that we see gets a complete history and physical, nutrition assessment, social assessment. We talk about their finances, all these things, and then we look at the home in general and we do the safety assessment, and it's door to door. I wrote the program, and we look at anything that is a fall hazard, any sort of a safety hazard that's in the home, and we can either make a recommendation on how to fix it, or we'll be down on our hands and knees taping down rugs and oxygen tubes and things like that. So.
Yeah, my parents are at that age. I just got back from visiting them, and it's so hard to see when they have difficulties getting around. It seems like you guys are making old-fashioned home calls like doctors used to do in the olden days, which is really cool. So how do you work with physicians to make sure that the patients are getting the care that they need?
The physicians are the ones that send us out into the home. We work with primary care physicians, with emergency room physicians, hospitalists. We also work with physicians who are behind the scenes on adult and child protection. So they're the ones that are sending us into the home and having us do all these evaluations, and then we report everything back to them so that they're able to kind of tie the loop together and put everything back in place for that patient.
Sometimes one of the most difficult things is to have a loved one fall. Like I know when my grandma, she was perfectly healthy, but she fell, broke a rib, that led to pneumonia, and then unfortunately her passing. So do you do any kind of prevention to help falls?
We do a lot of that. We're currently working with Colorado Mountain Medical in our area. We also work with two other Mountain Family and Eagle Valley Medical Center. So when a patient is identified of having a high fall risk, the physician will refer us into the home. We'll go out, we'll do the full home safety assessment, fix what we can do, make recommendations on what they need to do, and they're also referred to Howard Head, and they get a physical therapy review. And so we can kind of work together, put those pieces in place, and then they go to classes that teaches them how to gain strength and regain balance and things like that.
I love looking at these pictures. I bet you have a lot of success stories.
We do.
Would you mind sharing one?
You know, a lot of people focus on the fall stuff, but we do a lot of medicine too. One of my favorite stories is a 44-year-old male diabetic who had diabetes since he was age 5. And in the past 8 months, he had called 911 18 times for diabetes problems. Wow. So we got into the home, physician sent us out, he goes, what is going on? Well, long story short, when he switched physicians, the records didn't switch with him. There had been a medication change the new physician didn't know about. They assumed it was a diabetic problem with the nutrition or something like that, and it was really a med. So we got that turned around. We haven't heard from him since.
That's great. That's fabulous. So are community paramedics kind of replacing the current healthcare system?
Absolutely not.
Okay.
We are working with the healthcare system, with primary care physicians. We really see that we're filling in those gaps. The primary care physician and then the long-term health, like home health and hospice and things like that, there's a lot of patients, you know, adult and young, that fall in between the cracks that really need a little bit more things at home that they can't get. That's our role, is to go in and help them in those situations.
Do community paramedics have the training to be like a primary care doctor?
They're not primary care. Again, what we're doing is we're kind of filling in those gaps that the patient really needs from their primary care physician, but a lot of times can't get there. Or a lot of these patients really just kind of qualify by the fact that they're alive and kicking, and they need some extra help in the home. And so we get out there and we do these things. But again, we're always tying that loop back together. We're involving the physician. This is what we found, and this is what we think. What do you want to do?
How many patients do you currently care for?
We have, most of our patients are a one-time, two-time thing. So we'll go into the home and do one or two things and then leave, and we won't see them again. We do have a few patients who don't qualify for long-term care, but they need a little bit more help, and we've got about 7 of those right now that we see on a kind of every other week basis to help them with their meds.
Wow, and how much does this service cost?
It is free.
It's free?
We are offering this service free of care, or free of charge. We are we're looking at different reimbursement models with Medicaid, Medicare, private insurance, things like that, but for the last 5 years we've been offering this for free.
I need to find out if you're in Missouri for my parents. No kidding. Call right now, 970-926-5270. This is a great program. If you have someone that you think may need just a helpful eye and to help in between physician visits, 970-926-5270. What about transporting if you think a patient needs to go see the primary doctor right away?
So I wrote some protocols in our agency that state that when we're into the home and we see something that's not quite right, we've got a list of things that if it's this severe, we're going to do these things. Most of the time, a phone call to the physician will allow us to kind of fix what we need to fix in the home. There are times that we'll get on the phone and we'll hunt down a family member or a friend and get them to the physician's office. And again, there's times when I've had to call in a transporting unit to come, and so my cohorts would come in and load them up and take them to the hospital.
Well, thank you for all the work you're doing.
You're welcome.
It's really appreciative. Okay, if you live in Eagle County, you want to talk to your physician or medical provider to have a community paramedic visit free of charge. For more information, call the Eagle County Paramedic Service. The number 970-926-5270. You can also visit this website. It's eaglecountyparamedics.com.